Because of the level of care or skill that a nurse needs to be competent in our single-stay model, which is from a floor all the way up to an ICU level care, it's always been challenging for us to hire new graduate nurses into our program because of the huge learning curve that they face when they join our program.
This program gives them more of a focused kind of look at the importance of the cardiac system in the critical patient, and also gives them a better look at, and also kind of gives them a better hands-on together with the didactic learning, so they can do, if they come up and have a complicated patient on the floor, they can go back to the nursing program and talk to the instructor, and they can do a sim lab, kind of simulating that scenario that they might have felt uncomfortable with or not quite prepared for. So it really kind of helps them grow a little bit quicker. It gives them the extra boost that they need to get into the critical care arena.
They're here. They're working under the auspice of another RN, so they're really getting the benefit of the one-on-one attention.
My role as a preceptor for the new grads is to welcome them into the nursing program in the critical care setting and let them realize that they're not supposed to know everything, that this is a very high acuity environment, and they're brand new, they're just out of school, and we're here to teach them from day one. And when they're off orientation after 6 months, they're still not supposed to know everything. I've been a nurse 25 years. I don't know everything. I learn something new every day. So these new grads that come in, I like to reassure them that you're not supposed to know how to do this right now. We're here to support you, and even when you're off orientation, the safest nurse is the nurse that's going to say, I need help, I don't know this answer.
I believe that the didactic portion allowed me the opportunity to focus specifically on the classroom and understand exactly the basic fundamentals that you need to do the job in the critical care environment. I believe that having the one-on-one experience for the duration of time that I did have with my preceptor nurse gave me the opportunity also to further hone in on those skills and learn the things that the classroom doesn't teach you. So classroom kind of goes over cardiac rhythms and the things associated with doing your assessment and the things necessary to care for that patient. But the one-on-one experience actually gives you the hands-on, and it teaches you more and more about those cardiac patients that we have coming back from cath labs, from surgery, so on.
In conjunction with the nurse residency program, giving them that extra boost out of college as soon as they come out, graduate, and get their nursing degree, the nurse residency program gives them that extra kind of push to give them to the level that we need them to be. It started out being very cardiac based, but now we're kind of putting some critical patient aspects in there also to give them a better understanding of the pathophysiology of a critical care patient.
The program is built on a 12-week schedule, and the staff are full-time through that time frame. It varies week to week, the number of hours that they're out there on the unit with their preceptor, and the number of hours they're in a classroom setting. I would say on average they're at least 24 hours on the unit with their preceptor and 8 to 12 hours in the classroom setting. So it really is kind of a dual process.
We have a very structured orientation process where they come into very basic hands-on assessment, and then we progress them based on their ability and how fast they learn. So it's a very self-directed and self-tailored program. We don't want anyone to go too fast through the program, but we also want to make sure they're going fast enough so they're staying up to speed with what needs to be done, because it is a fast-moving program.
They're mentored longer. They are given a lot of education that goes along with their current employment or where they're interested in. Like here on SSU, they get a critical care course. They get, more in-depth teaching way beyond nursing school. And it does impact a great deal. We invest a lot in our employees when we do those residency programs, and it shows.
They're never alone, and nursing, especially critical care nursing, can be very stressful. So as a 25-year veteran nurse, I always ask for help, and if I don't know something, I hope I pass that on to them, that they need to ask for help if they don't know something.
It gave me the necessary skills to be able to understand what to do, but having the one-on-one preceptorship with my nurse is what really, I think, prepared me better for being a critical care nurse in this cardiac wing. I just feel that the added time that you get and the added hands-on gives you better skills to be better prepared to do your job.
It really helps prepare them to critically think through those crisis moments where otherwise they'd be standing there not knowing quite what direction to go in. So it really helps build that foundation that they would need to be successful in the critical care setting.
It gives them a great solid foundation to begin their nursing career, really with the focus of cardiac, which is, you need that background in whatever field of nursing you're going into. That's a very important part of your knowledge base. So we feel we've been very successful and look forward to upcoming years.